First, let's clear the air. Endometriosis is not synonymous with infertility. Hello everyone, and thank you for checking us out. This is SAC Health Answers, our video series where we take your questions and answer them so that we can give you the knowledge to make the best decisions about your health and well-being. My name is Dr. Jason Lohr. I'm the CEO here at SAC Health, but I'm also a practicing family medicine physician. And today we have a question from someone, this is anonymous. We are opening our hearts to a question that carries a lot of weight. So the question says, what are my chances for getting pregnant if I have endometriosis? I want to start out by saying this. Endometriosis is not synonymous with infertility. I hear this fear often. Patients who have endometriosis are very much worried that this is going to cause infertility. But just know that this diagnosis does not mean that. Statistics will actually tell a much more hopeful story. First, let's clear the air. Many women with endometriosis are able to conceive naturally and have no difficulty carrying a baby all the way to term. The general statistic is about 60 to 70% of women with mild to moderate endometriosis are able to get pregnant without any medical intervention. In the comparison in the general public, about 15 to 20% of couples will face infertility. With endometriosis, that number jumps up slightly to 30 to 50%, but again, it's not 100%. So let's talk about some things that we can do in order to help that. Really, your chances depend on the stage of disease, right? Because we can have everything from stage 1 to stage 4. So in the 6-month rule, usually we allow people to spend a whole year, 12 months, trying to get pregnant. And if there's challenges, then we can talk about medical intervention. But when you have a diagnosis of endometriosis, we don't want to wait that long. Really, after 6 months, if there's been actively trying to get pregnant and there's no pregnancy, then you want to connect with a healthcare provider to have that checked out. The other option is something which is actually surgery, typically a laparoscopic surgery procedure. We would actually call this a type of excision surgery where the tissue, the extra tissue from endometriosis is removed. Studies show that there's a significant boost in the ability to become pregnant naturally after the months after doing a surgical intervention. And if that doesn't work, there's always in vitro fertilization. IVF, in vitro fertilization, is when natural conception isn't happening, that's an option. It really helps to bypass what could be a hostile pelvic environment that endometriosis can often cause. So to answer your question, your chances are still good, but you do need to be proactive, not reactive. There are thousands of mothers out there that are holding babies, healthy babies, who ask the exact same question that you did. So thank you for trusting us with such a personal question. Thank you for joining us for this episode. Remember, your primary care doctor is your partner in your personal health and wellness. So remember to connect with them with any health questions you may have. Thank you for joining us for this episode and hope you join us next time.